Not a lot of things have gone right so far for Katie, or at least how she would see it. Her husband finding the box and realizing that she was abusing the prescription painkillers is actually a good thing. And the positive elements that exist in the situation are the fact that Katie does have a family that cares for her and would support her through this, as long as she's able to be honest with them and transparent. So, the factors that are related to this situation are the fact that Katie was dealing with stress and she's had experience with prescription painkillers back when she had a car accident. Maybe she didn't necessarily need the painkillers then, um, or she did and she continued to use them or was prescribed too much that she knew what they could do for her and she felt it would be okay to start abusing them. These factors influence the situation because they fuel this cycle of abuse. She used the painkillers. She knows what they can do for her, like I mentioned. Now she needs an alternative way to feel better, and this is the thing that she remembers helping her the most. Rehabilitation programs have shown to work very well in these kinds of situations, not only to detox the patient, but also to help them determine what behaviors need to be changed and what in her life is triggering her to feel the need to abuse these drugs. The options that are available are both uh, actual treatment as well as medicational treatment, but I think that a cognitive behavioral therapy would be the most beneficial for her because relapse is incredibly high if behavioral changes are not made. So I think that a cognitive behavioral therapy would be best to get down to the bottom of what's triggering her to abuse the drugs to begin with. To make a viable plan as care providers, we need to know the etiology of this abuse. Is it genetic for her? Did her family have a history of substance abuse? Was she just going through a depressive episode or a stint of anxiety and she was looking for a way to cope? We need to figure this out and ask our patients this, because once we have this information, we'll be able to really help her and get to the bottom of what is causing um, this drug abuse and how we can help her moving forward. I think over the next weeks/months, Katie should be put into a rehabilitation program. And following this, in the next 6 months, I think that Katie should be receiving counseling, possibly taking an antidepressant or anti anxiety. And this will be based off of what we're able to learn within the rehabilitation program and what's really causing this anguish that's putting her to feel the need to use the drugs.